It's not very often that a patient gets the opportunity to bring something off of a page, or I guess now in this technology, off of a laptop, and explain a diagnosis and make it real, and show you that there's a person behind a diagnosis. And I can tell you for sure, it's not very often that a patient has the opportunity to educate doctors who will be taking care of her in the future, or maybe even diagnosing a patient of your own.
You know, I go back to work right after the appointment, and it's getting so bad that I can't even swallow my own saliva without just tears pouring down my face.
She told me, you have bad oral hygiene and you need to learn to brush more.
My mouth at this point just feels like raw meat. It's just been biopsied and looked into and poked at, and I was like, oh, I'm miserable.
Well, we talked about what was going on, and he said, well, can you have a look? And he looked inside of my mouth and he cringed and went, ooh. And let me tell you, if you can make a gastroenterologist gross out, you really are somebody, right?
My prayerful goal is that you guys would take away from this a personal account of something, so that way you can put a face to a disease, basically, and that we're very real people, and that there's a lot of rare diseases out there, but this one will affect you.
Oh yeah, and I started babying my mouth. I didn't talk like this back then. Instead, I talk more like this. It's kind of hard to understand me, but at least it wasn't ripping the scabs open in my mouth.
I mean, sometimes you only have 5 minutes with someone because you're busy, you have a lot of patience. And if you can just think in your mind, how can I make this 5 minutes the most effective with this person? You know, to kind of zone in on what they're really saying, biopsy, what we need to biopsy, then you can develop a really quick rapport with someone and have a very, very successful career.